Hi, I'm Kathleen Wallace. I'm the head of provider operations here at Tuned, and we are here to celebrate World Hearing Day. And specifically, we are discussing the often overlooked population of how hearing health is treated and managed in the workforce. So, we have a few different stakeholders that we've brought together today to talk about this issue from a few different perspectives. And I'd love if we'd be able to all introduce ourselves before we dive deeper into the topics. So Denise, if you could start us off, please.
Absolutely. Hi, I'm Denise Stanley. I am District Sales Manager for Colonial Life and Accident Insurance Company, and I am located in Orlando, Florida.
Okay, Nick.
Hey, I'm Nick Reed. I'm a clinical audiologist by one background and an epidemiologist by the other background. I'm an associate professor at NYU Langone Grossman School of Medicine. There's a lot to say there, with appointments in otolaryngology, population health, and the Optimal Aging Institute.
Okay, thank you. And
I am Heather Malyuk. I'm head of audiology for Tuned. And to get us started, I just want to give a little introduction to what Tuned is. So, for anyone watching or listening who has not heard of Tuned yet, we are the first ever teleaudiology and hearing wellness health benefit. We're really trying to make hearing care as accessible as vision or dental care in order to usher in this new era of whole head health. We're unique in the benefits space in that we focus on a more holistic approach to hearing wellness, and we address everything from prevention to intervention rather than just focusing on those who have hearing loss and are in need of hearing aids, though we do that too. Our goal is really to connect working aged individuals with audiologists for triage, second opinions, education about their hearing, and more. And we do this by offering a robust three-part online hearing screening protocol which gives us an idea of an individual's hearing and their needs and whether medical referrals are needed, consultations with specialized audiologists, and a variety of both hearing conservation and amplification products, as well as pathways and products for those who are managing other hearing and balance disorders. The care and integrity our audiologists exhibit is, in my opinion, the biggest feather in our cap as a company. They truly view each member as a unique individual and provide really thoughtful and tailored audiologic expertise that is always in the member's best interest. And our company does go above and beyond being HIPAA compliant. We are also SOC 2 Phase 2, ISO 1600, and GDPR compliant. While I believe we are one of many companies trying to expand the field of audiology to reach more people, I believe we are one of the only companies that is truly showing off the value of audiologists and audiologic care navigation. I'm really proud of what we've done so far and where we're going. And I just want to thank everybody today for being part of this panel discussion for World Hearing Day. Take it away, Kathleen.
well, thank you. And that's a good segue into talking about what the current state of hearing healthcare is in the workforce. And Denise, given your perspective, I'd just be curious to hear how familiar were you with hearing healthcare services? How new is this to be able to offer it to your clients?
Thank you. I wasn't aware at all, like most people. In fact, when I talk with people now, my first question to them is, when was the last time that you had a comprehensive hearing examination? And the answer, almost 100% of the time, is never. It's the kind of thing that I think we've only attended to once we had a problem. And by the time you notice there's a problem, obviously, you're well past the point of prevention and mitigation at earlier stages, which is sad since it's not available as part of our medical programs in the United States. They do everything else. I mean, we're all checked for our eyesight. We're all checked for our BMI. We are, checked for our weight, blood pressure, and everything else you can think of. But for some reason, that's been overlooked in our medical care, at least as it's provided by employers, which is typically what we do in offering benefits to their employees at the workforce. So if it's not offered with the medical programs, most employees assume that it's just not necessary or it's not something that they have to concern themselves with. And it's obviously the wrong message to send. The only thing that has been offered in the past have been discount programs for the devices that are needed, again, once the person has passed the point of no return. And I think that that's sad because that's a reactive approach to the need as opposed to proactively providing education and prevention. What I have seen as a need out there is for this to be offered as a kind of stopgap measure, particularly with those organizations who are looking to be able to help reduce cost, attract new employees, et cetera, by offering wellness initiatives in their organizations. And they do in those cases usually include things like weight loss and, tobacco cessation programs and things of that sort. But again, there is a huge gap in that if they're not attending to the hearing needs of their population either. And so that's something that we have tried to be able to impress upon them. I think it's a very underserved need in our society as a whole and definitely in the workplace right now. But I think that the situation, the way things are right now in the economy and in the workforce, that it's the kind of a thing that has attracted attention and certainly just needs to be, I guess, promoted more with them. They need to be made aware of both the need as well as the possible solution that Tuned offers.
Yeah, and I think you raised a lot of great points there. Nick, I'd be curious what your perspective is, because you really do have quite a unique perspective given your background in audiology and then, of course, your population health and epidemiology knowledge base as well. So, what are your thoughts given everything Denise just said?
Yeah. No, I think there's the way to sort of build off that because I think there's a theme that I'm hearing about lack of offered services to this population, but also, I think deeper on what the specific services are. And from a population health standpoint, two things sort of stick out to me when we talk about working age adults, right? There's a wonderful paper that just came out. I should actually just came out. It came out like a year ago, in the American Journal of Public Health where Michelle Arnold and colleagues looked at state mandates for hearing care, right? And so now we're talking about, private insurance mandates for working adults in those states. And from 2008 to 2022, we go from something like 3.4 to 18.7 percent of workforce in across the United States being, under some sort of mandate, which I think when you think about like the proportion of privately insured adults is like going from like literally like 0.3 to like around 5% of all, privately insured adults being part of a mandate, which is a pretty massive increase actually. It doesn't, absolute numbers, not very high. But what's fascinating in that same period, even, we're also seeing Medicaid explode in terms of hearing aid coverage. But the devil's in the details, right? That those papers, when we look at those numbers, those are going up. But if you look at data from our team on the actual just adoption of hearing aids, not even engagement numbers, because we don't have those often in epidemiologic studies and insurance, actual claims or e-health records, we actually see that aligning with this period from 2011 to 2018, the number of adults who are Medicaid eligible as actually the uptake of hearing care is actually going down. So they're actually using hearing aids at a lower proportion, minus 13% actually from their baseline in 2011. We also don't actually see much evidence that hearing aid uptake, and again, that's a crude way to look at it, is actually increasing in this working age population. We do, however, see 70 plus, not many working. We do see overall hearing aid uptake increasing there. And so I think there's a lot of these like this juxtaposition of sure, we're saying something's going up, but are we really offering the services people need? Are we thinking to Denise's standpoint about prevention and actual information instead of just like we got a hearing aid and I would never like name states, but you can actually look at the Medicaid side. There are literally multiple states that say they cover hearing aids for their Medicaid population. But what they actually will do is just mail you a prescription hearing aid, and that's it. That is useless to people. I mean, any audiologist can tell you that, for the most part, there's no software. No one has the software to do that. They don't know how to do it, And so maybe in the OTC world that starts to change, but still, it's a pretty crude way of thinking about it. And so we're not making a difference. And if you ask me as a population and policy person, I think a lot of this actually, unfortunately, starts with Medicare. And I know that they are different set populations, but Medicare does set the tone often for what happens downstream. And if you're looking at the distribution of hearing loss in the country and you sort of have this big U-shaped curve of a lot of pre-working age hearing loss popping up, right? We're talking about congenital hearing losses, progressive, genetic conditions, and then we're talking about age-related hearing loss on the other end, which is the big proportion of the population. When we only tend to focus on that congenital side in terms of insurance, children, and not the other side, we do sort of set a tone for what it is that we care about. And this gets back to things like prevention and stuff. So I, couldn't agree more. And, just thinking even more broadly about it, I see that there's some fundamental issues where this is one of those things like, one neighbor on the street's ruining it for everyone in some ways.
And that's really interesting. Heather, can you elaborate on what you've actually been seeing with Tuned?
That's exactly what I was just going to do. I was going to say from the tuned side. So part of my job as head of audiology is that I oversee all the audiologists, and weekly I do chart reviews. And so I'm looking at every appointment that has been done and what's been discussed. A lot of prevention is going on. So a lot of people getting on the call and saying, what do I need to do when I go to a concert? What do I do when I work with power tools? And we take for granted that we just know that we're audiologists and we say, well, of course you'd wear hearing protection. It's really not common knowledge. They want to learn about sound levels. People who are wearing headsets all day for work, they want to know what it might do to them. How do they keep their levels down? And very interestingly, over the past year, we've seen people specifically asking about how to prevent tinnitus. They've heard about it. They want to know what it is. They're scared of it. So I think the education portion here is huge, and we're just at the beginning of it. And what I hope to see in 10 years or 20 years, as these people go out and tell their families about all this, that maybe we don't need this much granular education, that perhaps people will just know, put my earplugs in, like they say, I'm going to brush my teeth. I'm going to floss my teeth, as we should all be doing, right? And so one day, hopefully, we're going to push this there. But that is what I'm seeing right now. A lot of prevention, a lot of people wanting to know how to avoid hearing loss, if possible, from sound exposure. And then the people with mild hearing loss, people who are saying, I think I need a little bit of help. I don't know what I'm ready for. Maybe they went and saw an audiologist in person and they didn't feel like it was catering to them. Or maybe they didn't understand something. And so they just want to speak to an audiologist who's not tied to a device. We're seeing some of that too. Because the audiologists over Tuned are not selling hearing aids as part of how we earn our income, I am seeing people coming for second opinions and saying, well, I need to get more information about this, about what I'm dealing with and what my options are. So sort of the scheme here of what we're seeing and what we're dealing with primarily.
Yeah, and it really is an interesting conversation. And I'm very glad to see that, hearing aids are no longer just synonymous with hearing healthcare, that it is just one facet of it, and there are other elements to it. Denise, is that something that people understand, or is that one of the friction points of really educating in order for them to sort of buy into this concept that yes, this is something you have to be considering along with every other part of your wellness initiatives?
Yeah, I don't think that they understand it, not yet, and not as pervasively as we would like it to be in the population. I think that to Heather's point, it should become eventually automatic, to protect your hearing as you would anything else that impacts your life. But at this point, I think that there is still the misconception that this only happens to older people. I think that there's still the focus from employers that this is a retiree benefit. This is a retiree concern. This is something that, when they get to be over 70, like, Nick said, that that's when they can concern themselves with that kind of thing. But of course, as we that's not true. And fortunately, I'm excited to hear from Heather that there are a lot of questions around education and around additional information, particularly amongst the younger workforce, because again, this was an eye-opener for me. It really, really looking at the videos, learning a little bit more about it when it was first introduced through our company and the partnership that we have. I was shocked to realize it just made sense. Yes, my kids, everybody, they're on a headset, workers constantly on a headset, or they have earbuds plugged in all the time, and they're not necessarily concerned with the volume or any of that sort of thing. And they're not doing anything to be able to help protect themselves down the road. Just every part of our world includes noise, and sometimes noise at levels that are unsafe, but we don't stop to think about that. We just sort of assume we're going to get through it, and I think we notice the damage that's being done. We just turn up the TV or increase the volume on the radio or whatever it happens to be, or ask somebody to repeat themselves, and we're not linking that to what's going on. Certainly not in the younger populations who already believe that they're bulletproof, let's be real, for everything else anyway, but where it starts, and that's where the problems begin. And I think what has to happen is we have to not only engage and educate the population as a whole, but we have to be able to educate the employers that this is having a significant impact on their employees and ultimately on their businesses, and that it is not something that somebody just takes as a benefit as they retire. So I think it's again, it's just awareness, and I don't think the awareness, unfortunately, right now is where it needs to be. But I think we're moving in that direction, and I'm excited to hear that things are being done to help promote this awareness with regards to this need.
In terms, I can say in terms of products weekly, so I see all the products that are going out. 50% are hearing protection. It's great.
Which is pretty
That's so
amazing.
much better. Yeah, I'm afraid to hear you say that it would be, hearing aids, and I thought, oh, that's really sad because, you know, it's not, it's just, again, it's reactive. And so I'm glad to hear that. I'm really glad to hear that.
And I will say we're still learning about sound levels in terms of what they do to our bodies, not just our ears, but our overall health. I
Mhm.
just went to the National Hearing Conservation Association conference, and this was one of the discussions that the safety scales that we use currently, they were designed for industry workers, and now there are public health professionals looking at sound levels in communities and looking at other parts of the body, and we're realizing the sound levels that might actually hurt people are much lower than we thought.
Oh, wow.
And moving forward, looking at how do we address this in the general population. And again, it comes down to education. There will other things will need to change too, but we can't do it all. So education is our part.
That's wild. I had read something, and I'm trying to remember where because I'm going to go back and find it. But it just had to do with, it was actually not about hearing, it was about stress and stress levels. But that was one little kernel that was in there, that it also talked about our exposure to, constant and continuous, noise in our environment. And that was interesting to me because I wasn't looking at it from that perspective initially. I was talking about other factors as well. But then it popped that in there, and I thought, wait a minute, you know, not one of the things that I expected to see in there. But then now that I think about it, yeah, that could induce stress. That could be something that after a while starts to kind of gnaw at you. So the awareness it's eye-opening. It really is, and it's necessary.
And I think when we're able to connect hearing healthcare to other areas that perhaps businesses or benefits folks will be more motivated to intervene with, such as earning potential or your work efficiency or your overall engagement with the healthcare system and medical costs,
Mhm.
there are so many downstream consequences of unmanaged hearing loss. Nick, I know you've done research on this. Any data that you think would be helpful to share here of how this impacts us?
Yeah, there's not solid data on something like, KPIs, something like that. But there is data on stress related to, unfortunately, most people actually frame it as stress, like actual physical stress, like cortisol levels causing hearing loss, right? We look at allostatic load in that mechanism. But if you also flip the switch, hearing itself, not even just we're talking about like the noise exposure that could cause hearing loss, but just peripheral hearing itself and probably communication breakdowns is what we're really getting at as a mechanism, causes changes in allostatic load, hypertension, poor diabetic control, things like that. My own work looks deeply at healthcare utilization and services and health outcomes. And so most people pay attention to they're very interested in this cognitive decline and dementia side. But I think when you think about employers, if you just look at our data showing that adults with hearing loss have 50% higher risk of 30-day readmissions, they have 17% higher risk of emergency department visits. Over 10 years, they spend $22,000 more on healthcare, just medical expenditures broadly, not including hearing care itself. But we see really, really population level differences in that. And including if you look at Medicare data, now we're getting outside of the workforce age population, but if you just look at Medicare, hearing loss, people with hearing loss push into, they're more likely to be in the top 1% of spenders, right? And that's when you actually think about spending, most people are relatively low in healthcare. Health, it's usually driven by this like one, literally like 0.5%. And people with hearing loss have like 90% higher odds of being in that 1%. So, you know, from an employer standpoint, you're actually thinking about, really saving money on the healthcare plan itself, right? And what goes into it. And, a healthier, just even think macro level, the healthier population is probably, a stronger workforce. I don't put people into these ideas of like, hey, you're going to do better for the company because at heart, I don't really believe in that mantra. Like, we are our own people, we all do our own things, we are independent, and we are wonderful humans. But if I was a manager looking, I would want a healthier workforce, and hearing clearly plays into it, and it's relatively low-hanging fruit compared to many of the other factors that go into healthcare utilization and expenditures.
And Denise, I feel like I've gotten a crash course in all the different acronyms that are out there in the benefits world. So PEPM, right? That's a big one. And how does that, what everything Nick said, reinforce like what you've been doing when you are having this conversation about, implementing a hearing healthcare benefit and how it is a relatively, as Nick said, low-hanging fruit to really get a healthier workforce potentially?
Well, first of all, I'd love to ask Nick if he can provide some of those statistics that you just talked about to us to be able to share, because particularly the impact on other, types of health concerns and stuff amongst people in general. I agree with you that most employees don't care whether their health affects their employer or not, but their employers definitely care about whether or not their employees are healthy because obviously that impacts productivity. And I think that one of the things here with regards to the whole, hearing issue and it's young in particular younger workers and how that affects employers down the road and the cost related to medical that they're trying to constantly, you know, keep control of, which is sort of a losing battle in some ways, as well as, to retain and attract new talent and new workers and stuff to be able to help them in their businesses. They're always looking for ways to improve, but again, cost is always an issue. The bottom line is always there. Typically, what happens is the employer looks to be able to make changes to the structure of their medical programs, increasing out-of-pocket expenses like deductibles, et cetera, in order to bring down overall cost on the health plans because they have a percentage that they have to contribute to the plans. If they have 50 or more employees, that's a requirement. And so they're looking to keep down their own costs. They're looking to be able to keep down employee costs so that they can keep participation up because lack of participation, sometimes due to cost, means that cost as a whole rise. So it's just it's a vicious cycle in that regard. So looking for ways to be able to help impact in a positive way their overall cost for healthcare because benefits are the second largest line item for most employers after payroll. They're looking at things outside of the medical plan itself to be able to help. So things like, mental health awareness, which is another thing impacted over here. Um, you know, like I said before, different wellness initiatives and everything, try to keep the employees healthy so that they can continue to work and be productive. Cost obviously is always kind of the key in here. It's like, you have to be able to balance that return on investment. When I go to the brokers that we work with, or I go to the decision makers, the companies that we assist, I talk to them about the thousands, sometimes millions, that they are investing in their employees' healthcare or wellness overall. And they're always concerned about we getting, the best out of this. Is our return on our investment worthwhile over here? And I'll tell them that if they're looking to be able to have a high impact on their wellness initiatives, the lowest possible cost, you can't get any better. So yeah, I think the charge the per employee per month is a non-issue. It really is a non-issue. but it's the education, it's getting the word out that's really most critical to getting their buy-in, you know, on the program as a whole. So,
It's interesting what you said about other family members because over the past few months, I have seen a couple of our providers working with someone, and what they're educating them about is
mhm.
how to communicate with a family member who has hearing loss or a
That's
friend who
cool.
has hearing loss. So the term for this, which I actually learned from Kathleen, is third-party disability. And it's really cool. You know, when we see someone with hearing loss and we give them all these tips about communicating and using their hearing aids and all this, it puts all the responsibility on them. But really, it's a treat, right? And so it's been really nice to see that. It was two or three different chart notes where it was all the recommendations to communicate with someone who has hearing loss. I actually, one might have been a coworker. In any case, just to piggyback off of what you said, we're seeing some of that, which is pretty cool.
Yeah, and I think that you raise a great barrier that we hear over and over again. This is something that is new, not new to at all, is the lack of awareness and the need for education. Nick, do you think that is still the biggest barrier, or is there an issue of, whether this is like an individually driven healthcare decision, or is it more powerful when it does come from an organization, whether that is your, major medical covering hearing healthcare or an employee benefit? What are your thoughts on like what the barrier would be to get this to become mainstream?
So I'll actually offer a third side to this, and I blame audiology, hearing care professionals, and the field itself. And what I really mean is, what is hearing loss? No one knows. And if you start to look up the definitions, the professional organizations, the World Health Organization, Johns Hopkins Bloomberg School of Public Health has a major app out, and they all define it differently. And this is and they're usually using a very specific definition as well, which is really just peripheral access to sound and nothing about processing sound. Because the truth is, if you ask somebody about their hearing, they're thinking about, can they understand speech, right? They're not thinking about whether or not they have access to some tone or some sound. They're thinking about the processing part, and that's a cognitive aspect as well. And so I think we've done a really bad job of trying to sort of even just have a basic vital sign, if you will, or basic understanding of what hearing loss sort of is for people. And I would use the analogy of people don't understand blood pressure either, but at least we're sort of aligned on what like sort of the basic construct is, the basic numbers, and what it means to be within those basic numbers. Whereas we don't even have sort of a range that you could give someone for hearing loss. We use big, broad terms. It's sort of a binary, like, well, you have it or you don't have it. It's mild, it's moderate, but we don't even define those really well. So I actually think a big part of the confusion is that when somebody suspects anything, it's not just that services are complex and sort of hard to find. It's that if you look for guidance and you try to put yourself in a box somewhere, which of course everybody is their own individual, but the entire basic construct of medical care is looking for that specific box that this fits in and then working within that. And we can't even start with the big picture box of where you might be in this. I think a lot of people are giving up faster. And I've always harped on this concept of people talk about stigma all the time with hearing aids, right? Oh, it's age, it's whatever. I've never bought that to be full. And I'm sure there are people who want to use stigma, but stigma is a wonderful excuse when something is mostly out of pocket and very expensive and incredibly difficult to even figure out where the on-ramp to that highway is. It's not even the highway. We can't even get on the highway for most people. So when you put those two barriers up in front of people, I think that like, a lot of things we're talking about that are starting to get into the weeds. I sometimes think we're not even there as a field yet because even if we solved this, we might not get people on, right? And I think if you start to look to the UK, for example, I'm not saying the NHS is a perfect, situation, and they have problems where they're working now with private providers to contract to the system and provide hearing aids, right? But a lot of the aspects of coverage have been solved to some extent, and they still are not having much. Their uptake is maybe 5 to 10% higher than ours. It's not like massive significant differences. Same thing in the Scandinavian countries, which have the highest uptake in the world. So I actually blame the field to some respect that, maybe mild hearing loss doesn't even need hearing aids all the time. To your points, it may need protection, it might need basic concepts. We've done a bad job of sort of giving people those pathways. So, that's one look at it. I do think there are individual patterns, and we don't understand those very well from a research perspective. We don't really understand what contributes to people who buy hearing aids and never use them again. We don't really understand why people, who have all the other means but still don't engage in hearing care. But my personal thought is something we can control at this time is the big picture aspect and the professional aligning on messaging.
I just want to jump in and I want to shout amen, first of all, and just say, preach it, Nick. But I also want to say, I agree with you. And one of the interesting things I'm seeing with teleaudiology and putting someone in front of an audiologist and taking away the diagnostic testing equipment and taking away the need to make a commission on a hearing aid sale or any of that is being able to look at the person, assess their needs, get rid of confusion. And two quick examples. I had actually a phone call with one of our members the other day, needed some clarification because of hearing aids. Long story short, in the past, gosh, I think 3 years, he has seen 5 different audiologists and still felt like he didn't understand what he needed and why. That was mind-blowing to me till he spoke with someone who didn't have anything attached other than just talking to him. That was mind to me. The other example is someone who needs medical care for their hearing and they don't know where to go or what to do. So for example, someone with tinnitus, I'm thinking about who is from ours, saw their primary care physician. They were told, "Oh yeah, we there's nothing you can do about that. Go on your way." Well, really, they need to have a hearing test done. They need to go see. I had recommended an otoneurologist. They had never heard that term before, and have more of this looked into because there were warning signs. There were red flags about this tinnitus. And we can't necessarily expect a primary care provider to know all of this. They have so much information that they need. And so when someone finally gets to speak with an audiologist, then they can get on the right path. So like you said, Nick, getting on the on-ramp, and then it's like they fit it. They're like, oh, they're so grateful to know who to go see and what to do because they feel like they've been going around in circles and not being able to get care and they've been Googling and getting the wrong information. And so I agree with you 100%.
So do I. I've always thought that I say that audiology has a giant PR issue. Like nobody knows who we are, what we do, why you would see one. And I do think that at least Tuned is putting a dent in that, where if we can make it sort of the part of Tune that is, revolutionary is how simple it is and how straightforward it is. It is a conversation with absolutely no other barriers with an audiologist that you can just get very clear information. And over the course of the years here, the conversations, I've gotten a pretty good idea of how they tend to go, and it is audiology 101, if that. The level of understanding that people have about their ears is quite low, much lower than knowledge of most other parts of their body and their overall health. And just being able to answer what, again, to us seems like pretty basic questions that we think people know, that is pretty powerful. And even just explaining to folks that there are a broad scope of options. I always say that it's a spectrum. It's not just hearing aids or nothing. It's not just hearing loss or nothing. There's all these in between. And most people fall in that in between category. And that's something that I hope that we're chipping away and helping clear up to the, thousands of members that we do have. So I guess to close this out, what would we hope would be the future of implementation of hearing healthcare specifically for the workforce? Like, what do we think would move the needle the most to properly engage this workforce and perhaps their unique hearing needs? Because again, we tend to be focusing on either the childhood coverage, or we're dealing with Medicare, and that in between, the plateau in the middle doesn't always get the attention it needs. So what does that look like? Or what do we think it should look like, I guess? And I'll let Denise, you want to start us off here?
Sure. I just would like to see it be as pervasive as dental and vision insurances are right now. I think that there needs to be a way that we can find to, even if it means, and it probably will mean, increasing cost and making it an employee paid benefit, which is typically the situation in most companies for dental and vision as well. But having it be offered as broadly as those other coverages are, as ancillary products are, so that there's the population there to be able to support the potential risk. And it just needs to be, I agree with you on the PR issue, Kathleen. I think it needs to be understood and explained and educated enough to the employers that it's not even a question. They already offer medical, they always offer dental and vision. The hearing piece of that needs to be part of it. However you choose to package it or whatever it sounds like, I think it just needs to be automatically part of what's being offered because nobody thinks twice. Even people who choose not to take medical insurance because of the cost or because of, other reasons, almost 100% of the time they're going to take the dental and the vision. They should take the dental, the vision, and the hearing. It should all come together. And that should be sort of automatic. People already see the value of the others. We need to be able to make sure they can see the value for this as well.
Nick, you want to share your perspective?
Yeah, I mean, I couldn't agree more. I'll add that, I'm biased because I'm in academics and I, just spent a year doing a health aging policy fellowship, and I think that there is this need to do things, but I also think that one of the things that happens in when, if you look at our policies, things that we've put through forward throughout, right? I'm going to use Medicare as an example because it's an easy one to think about. Every single every should say, since Social Security Administration Act created Medicare, somebody has introduced eyes, ears, and teeth coverage. And it's never happened. We've never even voted on it actually until the Build Back Better plan. One of the things that happens is we have a little bit of research saying hearing is likely associated with or potentially causes something like dementia, but that does not mean doing anything about it actually reduces that dementia. And, a lot of people get frustrated with that concept, but there are plenty of risk factors out there that are associated with causing something, and getting rid of those risk factors actually don't reduce risk of dementia. That is completely possible. They are two different pathways. So I think that the things that we're sort of missing sometimes on these are actually filling information. And I think two things have to happen. We need a groundswell shift in audiology as a field and hearing science as a field to start including more people who use public health techniques to start actually testing trials of whether hearing care does anything. Literally doing things like cluster design trials in the work environment to see if it does affect, things like KPIs and people's, health in that environment. And I think something that is drastically missing specific to hearing relative to our vision and our dental colleagues are we have no central unbiased institutes that focus on hearing policy. And this is a real missed opportunity, right? We have our professional organizations and their lobbying groups, and they do a little bit, but we do not have a group of researchers that are multidisciplinary, bringing health services people, policy people, epidemiology, trialists, and clinicians together to say, hey, we think this is the best policy to go forward with and guide those state mandates and guide Medicare and guide even, Medicaid and child mandates, right? I think without that, we are going to keep spinning our wheels. And, you know, no affiliation with Tuned, I think highly of you, and I think you guys are doing a wonderful thing. But I think that, you're like fighting this battle in some sense. I mean, you are mining in like, actually, I was about to say like cobalt or something, or tungsten, right? You are mining in tungsten, right? You are mining in this incredibly dense material and fighting against it. When if you had allies out there creating this better machinery, you'd be mining in clay and you'd get there a lot faster, right? Like I really think that we need a massive shift in the way we think as a field. And at this point, after watching a lot of us sort of try and really do it on our side, because we're also mining in tungsten, to be honest, the number of public health audiology professionals is small. I can count them on one hand and I have all their cell phone numbers. Not good. This may even be a call to industry to some extent that if industry would like to see these kind of things, we may have to start funding these initiatives ourselves. which is a lot of buy-in and belief, right? That is hard to do, right? That's hard to trust everybody and say, here, academics, go do this. And in a time where nobody trusts each other, it might even be harder. But that is my perspective on this as a field, that lots of great things. I think it's necessary. I think you guys are doing wonderful things. I think some of the specific insurance providers are doing wonderful things. But we are all acting as, different regiments within a larger battalion and not without a general, right? I do worry about that as a field moving forward.
Thing. I have a question. Again, I'm more focused on what happens with the workers, obviously, and I like the idea of being able to do this at a younger age. But you've brought up several times the whole thing of Medicare, and it's true that Medicare itself does not provide that kind of resource, and even with dental and vision, they've gone back to this many times. But where it is provided is in the Medicare Advantage programs that are out there. They do
No.
include things like vision and dental. Why is this not being positioned with them as part of their programs there, as part of what they can get in the Medicare Advantage or in a Medicare Supplement program? Because God knows that's a big business right now.
Yeah, and I can answer that really directly. Big smile on my face because we have 3 publications in the past 3 months on Medicare Advantage and hearing care. Medicare Advantage programs that offer hearing care do not result in any uptake of hearing care at the national level.
That's
There's no
crazy.
change.
So
And
then it's again, we're back to the education aspect. Why are we not engaging programs like AARP?
I actually think it's not an education aspect here. And AARP has its own Medicare Advantage program, right? So
Right,
there's
no, but I'm talking in terms of promoting the need and that sort of thing, because people
and
don't use what they don't see as valuable, but typically it's because they don't
so
understand.
AARP is a great example. They
Mhm,
put out so much information on your hearing is important, right? They actually sponsored
mhm,
that study where we matched people over 10 years. We looked at 100,000 older adults, or actually not even older, midlife adults, and then followed them. And we were able to calculate those numbers on their healthcare expenditures. The bigger problem is that Medicare, for hearing specifically, the truth is also Kaiser Family Foundation has found that Medicare Advantage does not change health or dental and vision either. And this is contrary to Medicare Advantage actually often results in better health care. And I'll say 2 things. These are all statutory exclusions under Medicare. And
mhm,
so what Medicare Advantage is actually doing, we have a Medicare population, we have a Medicare program, and Medicare Advantage is saying, okay, we're going to add these other services.
mhm,
If they enhance services that already exist, things are better. If they add something that doesn't exist within the framework at all, nothing happens. Dental, vision, hearing. They are selling passes to Universal Studios, but everyone's going to Disney World. That is literally what's happening. I mean, that is like, that's a funny way to say it, but that's literally what's happening. You have excluded something completely and then said, hey, but spend a little extra money and we'll cover those. No one participates in it. The other problem is that they use third-party administrators, and that is snake oil half the time. And what I mean by that is the third-party administrator comes in and says, yeah, all right, we are part of this Medicare Advantage plan. You have 2 providers in your area, and you have a $500 discount on the hearing aids, but no idea of where those hearing aids started. And I have seen this with my own family members, where they then went to go use that benefit, and the hearing aids were $3,500 despite another person
yeah,
fully out of pocket being willing to do the same exact hearing aids as $2,000. And so the problem to me is again structural. Medicare Advantage cannot fill a gap if they are selling tickets to a different theme park. And that is probably what is, I mean, actually, I won't even say probably. I believe firmly in my heart of hearts that is what is happening in these specific areas. But to give Medicare Advantage the benefit of the doubt to some extent, if you look at something like diabetic care, hypertension, Medicare Advantage is actually extremely effective. So they can enhance, they can move you from an economy to a premium pass at a theme park that actually exists. They
mhm.
just can't add their roller coaster. That was a lot of theme park analogies. I don't know where it came from, to be honest with you guys. Not even been to a theme park in decades. Anyway, sorry, there was another part of your question, Denise, I think that you were asking that I was like also gonna just touch on. I totally forgot what the original part was, and I'm so sorry.
That's okay. I mentioned the Medicare Advantage, the Medicare Supplement programs, AARP. I don't know if that triggers anything there.
Oh yeah. I was gonna say AARP is yeah, I sort of briefly mentioned it. AARP is such a good example of somebody that is trying to educate
Mhm,
constantly and putting a ton of money into this space, and it doesn't seem to do anything on that specific Medicare population. And again, this is why, I am not a lot of things. I do that structurally we just lack a lot of the high level leadership that a field needs to make a difference. And this is like, I don't think audiology is like alone here. I think this happens in healthcare all the time. There are these brilliant people making differences, brilliant companies making differences, but then at the macro level, we sort of have lost the ability to lead the population. And it gets at the importance of public health, right? And maybe not a time to bring this up because we're cutting public health in this
I
country
know.
right now. And so in a way, I'm not even sure how we're going to fill some of these gaps, but public health is an important thing even for individual health decisions because they can lead that sort of better, broader sort of education side to your point. AARP can only do so much as a company. They keep putting things out, but they have to rely on what's already there. And if somebody like the CDC, like NIH, like National Science Foundation isn't creating funding mechanisms to say, hey, tell us why hearing care is important and tell us, how it makes a difference, and then finding the scientists to do that, AARP can say all they want, and that message is hard, right? And they have to rely on bodies like the World Health Organization, which has a very tough definition of hearing loss for people to understand. So I couldn't agree with everything you're saying more. I think at a high level we just, and this is my field. I'm blaming myself. We're like just really, really like working, but not working easy. Like,
And Heather, you want to close this out here with some of your thoughts on this?
Just I just had that went in a little different direction where I would like to see in the future increased access to audiologists just to see us. I mean, we know over half the counties in the US don't have an audiologist. It's not like other health professions. We are very tiny. And I would love to see an increase in teleaudiology, and I would really love to see an increase in research and development for us to be able to do even more remotely for people who cannot get to us. So that would be a big wish for me.